Hello, my name is Carolyn Whitrock, and I'm the mother of a 14-year-old daughter, Ella. Ella was diagnosed with avoidant restrictive food intake disorder, otherwise known as ARFID, which escalated to such a severe state that she required hospitalization and an NG tube at just 12 years old. As a baby, Ella was breastfed until she was about 2 years old. I had been advised by her pediatrician that extended breastfeeding could help prevent allergies. However, when it came time to introduce solid foods, Ella refused nearly all of them. Despite trying different brands and types, she never ate solid food consistently. Breastfeeding remained her main source of nutrition. The pediatrician reassured us, saying maybe she just does not like baby food and will eat table food when introduced. When we did introduce table foods, Ella stuck to what felt safe: macaroni and cheese, pizza, and spaghetti. Occasionally, she would eat some fruits and vegetables, but I often relied on pasta dishes with hidden vegetables to boost her nutrition. The pediatrician continued to tell me that picky eating was normal for her age and that she would likely outgrow it. Unfortunately, that never happened. When Ella was 8 years old, she went into septic shock after contracting a virus. Multiple hospitalizations followed, and she was eventually diagnosed with cyclic neutropenia, a form of bone marrow failure. During her illness, Ella vomited, and her fear of becoming sick and vomiting started to generalize to all settings. This anxiety only intensified over time. At age 11, Ella received a formal ARFID diagnosis, along with edematophobe, the fear of vomiting. She became afraid to feel full, worried it might lead to vomiting. My husband and I managed her care as best as we could until August of 2023, when her condition suddenly worsened. By age 12, Ella had nearly stopped eating, dropping to just 62 pounds. She withdrew from friends, suffered escalating anxiety, and endured severe panic attacks, even shaking at night. Alarmed by her decline, we contacted her doctors and took her to the emergency room. Eventually, Ella was admitted to the hospital with heart failure due to malnutrition. Unfortunately, the hospital's approach was not tailored for ARFID. Instead, Ella was treated as if she had anorexia nervosa or bulimia. Realizing Ella needed more specialized care, I reached out to Dina from the hospital. Within 5 minutes, she responded, ready to help. After Ella was discharged with an NG tube, Dina's intensive feeding program made a tremendous difference. With her help, Ella increased her oral intake from just a few hundred calories a day to over 2,000 calories and began eating a wide variety of foods. Progress my husband and I could not achieve alone. Dina's therapy incorporated choices and reinforcement strategies. She involved Ella in selecting foods, made the process enjoyable, and gave her some control while still increasing her oral intake and food variety. Dina also provided ongoing support and guidance to both my husband and myself throughout the journey. Although Ella achieved success through Dina's program, I often wonder if her condition would have become so severe had we received earlier interventions. We are taught to trust medical professionals, yet we were repeatedly told that Ella's eating problems were just a phase she would outgrow. Had intervention occurred earlier, perhaps the outcome would have been very different. ARFID is a very specific and life-threatening illness. Current medical interventions often mirror these used for anorexia nervosa or bulimia, but my experience with Ella demonstrates that these are not effective for ARFID. Unlike other eating disorders, ARFID does not involve body dysmorphia. It is rooted in sensory sensitivities and phobias. I strongly encourage the medical community to pursue more research and develop individualized interventions for ARFID to improve outcomes and successes. In addition, I encourage the medical community to take a more proactive approach when dealing with children that are considered picky eaters, rather than a reactive approach when they develop ARFID and become so severe as Ella did. Thank you.